Okay, so we have Miss Barkley. She's a 64-year-old female. She came from the nursing home with acute abdominal pain, nausea, vomiting for the past 2 days. She got a CT scan with some IV contrast. There was no bleeding. There was a small bowel obstruction. And then she was admitted. The provider ordered continuous telemetry, strict INO, keep her oxygen above 92%. She was NPO strict. So we were administering hydrocodone 1 milligram IV push for the first 3 hours as needed for pain. She was educated on the side effects of that. Her vital signs when she came in was her temperature was 99.8, her heart rate was 103, respirations were 16, blood pressure 118 over 68, and her O2 stats were 96 with a 6 out of 10 of pain in her abdominal area. We did some measurements and we redid her vital signs at the end of the shift. Those respirations and heart rate respirations went up to 22, heart rate went down to 96, blood pressure skyrocketed up to 147 over 80. Her pain was lower, it was a 3 out of 10, but her O2 stat dropped to 93%. She didn't void all day for me, so I took her to the bathroom just a little bit ago, and she voided 200 milliliters of dark concentrated urine. So we went ahead and hooked up a bolus, 500 milliliters of normal saline, to infuse over an hour. We did a renal function panel about 6 hours ago. She has not had any more urine output, but her bladder scan showed about 60 milliliters left in her bladder. She did have some crackles in her lungs, but her O2 stat dropped to 98. We did get her renal function panel back. Those are in the computer. She is currently getting that normal saline bolus. We did some education on making sure she's taking in enough fluid, why we're giving her so much fluid, and the doctor's talking about giving a diuretic. So she was a acute kidney failure patient. The doctor has given that as her diagnosis. So as of now, she's just in her room, and I would check back in a little bit.